Hi, my name is Benita. I'm an occupational therapy assistant working in an inpatient rehab center. My goal is to help patients to participate in their regular activities such as ADL and IADL through the therapeutic activity we do here in a rehab center. The purpose of this video is for my patient's family member or caregiver who have asked for a video with instruction on how to complete passive range of motion to the shoulder, elbow, hands and fingers with their loved one. And the purpose of passive range of motion is to keep joint mobile while decreasing pain or stiffness and swelling, thereby increasing the circulation toward the joint. Passive range of motion is done when myself as a therapist, family member or caregiver does moving and the person cannot. The person's body part is moved passively through such as much as range of motion as possible by another person, making sure he or she is in a safe position at all time. Okay, this is my patient. Hi, Carlos. How are you doing? I'm Benita. We are OTA today.
Thank you.
You're welcome. We're going to be assessing your joint, your shoulder joint, your elbow, and your finger and wrist through range of motions. We're going to start by sitting down, which you are, making sure your feet are flat on the ground. Are you comfortable right now?
Yes.
Making sure you're sitting on a chair and flat, your feet are flat on the ground, and I'm as a caregiver or therapist, I should be able to move around your chair, so I'm easily assess his joint, moving his joint through passive range of motion. So let's start with your shoulder. As I'm moving your joint, I want to make sure that you visualize the movement, but I don't want you to help me. But let me know if there is any pain or are you feeling uncomfortable while I'm doing these joints. Okay, Carlos?
Okay.
Thank you. I'm gonna go ahead and do shoulder flexion, going all the way, making sure I'm stabilizing on the proximal of the joint and distal of the joint, shoulder flexion, and I don't want you to help me. I should be able to do this on my own. Okay, and then do shoulder extension going behind body. How are you feeling? Shoulder flexion and shoulder extension. These movements you should be doing it at 10 times, but stop if there is pain at their joint. And next one, we'll be doing shoulder abduction, stabilizing in the proximal and the distal, doing it at least 10 times as needed or indicated by a therapist, and stop if there is any pain. And making sure the caregiver has the good body mechanic as possible, standing or squatting if they need it to be. Shoulder abduction and shoulder adduction. And next one, we're going to be doing shoulder horizontal adduction. How are you doing? Any pain?
No pain.
And shoulder horizontal abduction, shoulder horizontal adduction. Okay, next is we're going to do shoulder elbow. We're going to do elbow flexion and stabilizing on the proximal of the joint and distal. And I'm actually, kind of making sure I have a good body mechanic as well. Flexion and extension. Next one is pronation, supination of the elbow, forearm, pronation, supination, and we also need to do shoulder, having their shoulder right on the 90-degree, and internal rotation and external. How are you feeling? Okay, any pain?
No pain.
External and internal. If the patient is not able to do it like that, they can always we can always do it like assess the range of motion, internal and external and internal rotation of the shoulder from here. Next, we're gonna move the client to the table, having their left arm on a table and sitting down. Thank you, Carlos. Thank you. We're gonna start first with wrist extension. I'm making sure I'm stabilizing his forearm, but proximal of the wrist and the distal extension, wrist flexion, like that. How are you doing? Are you comfortable? Extension, flexion of the wrist, and then we're gonna do make sure radial deviation. I don't want you to help me, and I should be able to do it. And radial deviation and ulnar deviation. Radial deviation and ulnar deviation. Next one is MCP flexion and extension, and next would be IP flexion and extension, and MCP flexion right here, extension, making sure the stabilizing the proximal and the distal. MC flexion and extension, and IP flexion and extension, and last but not least, make sure I don't want you to help me, but are you comfortable? Is that better for you?
Yes.
Okay, do the CMC abduction and adduction, adduction. All these range of motion should be done at least 10 times, but stop if there's pain. And thank you so much, Carlos, for being with me, and I appreciate it.
Appreciate your help.
Thank you, and thank you all for watching.